AI is all around us. We can't ignore it. Self-driving cars, ChatGPT, all of these different tools that we've become accustomed to seeing. It's now also in healthcare. What does that mean for you? What does that mean for doctors? And what does that mean for the future of healthcare? Even now, AI is used in diagnostic imaging. So what I mean by that is sophisticated computer models can detect breast cancer sooner at an earlier stage, more efficiently and faster than experienced radiologists. Just by analyzing loads and loads of different images and mammograms, these computers can work out when a lesion may or may not be serious, and with greater accuracy. This is a fantastic development. Imagine detecting a cancer before it's progressed. Imagine the treatment that could then be undertaken as a result of that. It can be used in predictive health population models. So for example, mapping the progress of a disease and things like pandemics, and then allow us to take actions to deal with them accordingly. For you as an individual, it may be able to offer you specific personalized medical interventions that are not population-based, but are individual-based, specific and tailored to you. Then there's the whole access to care, remote access, telemedicine, so video and telephone consultations, virtual assistants, chatbots. You may have found now when you call your GP that you're asked to fill in an online questionnaire. At the moment, these are very cumbersome and tiresome, but they will develop with time and will become more sophisticated and even perhaps be able to give you a tentative diagnosis. So all of that will help the doctor to triage your case and make sure you get the correct treatment when you do get to talk to them. Another fascinating use is that of drug discovery and drug development, finding new molecules for new drugs that can be used in novel diseases. So this will help reduce the cost and time involved to bringing a new medication to market, allowing it to be used sooner in disease treatment. One thing that we all hate is admin, paperwork, bureaucracy. AI has great potential to minimize that, allowing doctors to focus on what's important to them, the patient and the clinical situation. In a previous video, I talked about non-medics doing surgery. Imagine a robot. Well, actually that exists already, and many surgeons are now trained in robotic surgery. What that means is the robot is assisting them carry out more effective and more precise surgery. It is still overseen by the clinician, but the robot is there to help and assist. So hopefully going forward, this will result in cost savings, in streamlining processes and increasing efficiencies. So we've talked about what AI can do to help, but what are the downsides of AI? So data and security. Personally, I'm not that keen for Google and Facebook and all of these other massive corporations to hold reams and reams of data about me. We already give away so much when we sign up for any service. If they have access to our health information, imagine what that could do. How will it be used? Who will it be shared with? So will it be shared with third-party providers to sell us the next wonder drug? So essentially, AI is only as good as the person that's trained it. So it may be prone to inherent biases. For example, will it be better at detecting moles in white people than black people? This is a very real problem that faces dermatologists in modern day practice. Job displacement. The implementation of AI will inevitably have an impact on the jobs that people do. We've already discussed how AI is now diagnosing lesions quicker and faster than radiologists. So are doctors at a risk of losing their job? So in the long term, AI probably will save costs, but setting it up is extremely expensive. Right now, larger healthcare providers are in a better position to implement this. So as already mentioned, AI is only as good as the people that have trained it. So inaccurate data input may lead to inaccurate outcomes. Okay, the use of AI in decision making leads to ethical concerns. If something goes wrong with your surgery, or you're misdiagnosed or given a wrong treatment, who is held responsible for that? AI holds great promise in revolutionizing healthcare. It can improve accuracy, accessibility and efficiency. However, it also presents challenges that need to be addressed, and we need to make sure it benefits everyone equally. Everyone has their own opinion about AI in their own industry, and I know I've got my own opinion of AI within medicine. What do you think about AI in medicine? Let me know in the comments down below. If you'd like to discuss this or any other health concerns, then reach out to me. My contact details are below. And remember guys, true wealth is health.